It's really my great pleasure to welcome everyone. And thank you all so much for attending Building Your Emotional Toolbox during COVID-19. We are really delighted to have you all here and so excited to hear from our distinguished faculty in these extraordinary times. We're also excited for you to join our one of our first events here as a staff group collaboration here at UCSF. Your co-hosts today are the UCSF Staff Assembly, the Administrative Management Professionals, AMP, the Diversity and Inclusion Certificate Program Alumni Group, and the 4CI Staff Subcommittee. We're all passionate about supporting the diverse, impactful, and vital staff here at UCSF, both campus and medical center, and are so proud to have come together for this event. A thank you on behalf of our steering committee, Brooke Spiggert, Denny Cambier, Colette Onoko, Deb Ryder, Janice Villanueva, and myself, Psyche Ann Qureshi. So again, a welcome. We have a really fantastic lineup of speakers with time for Q&A at the end. So please put your questions in the chat at any time. A reminder that this is being recorded. It'll be available through the Department of Psychiatry, the Cook website, and our sponsoring organizations as well. It's my pleasure now to introduce Dr. Margot Kumar, our moderator for today's program. Dr. Kumar is Associate Clinical Professor in the Department of Psychiatry and Behavioral Sciences. Her clinical roles here at UCSF include perinatal psychiatry and transplant surgery. She is also the Associate Medical Director for Integrated and Collaborative Care and the Director of Special Interventions for the UCSF Employee Coping and Resilience Program, or COPE, developed in response to the COVID-19 pandemic. Without further ado, I hand it to you to kick us off today, Dr. Kumar.
Hi, everyone. It's so wonderful to be here with you. I'm really grateful to present this wonderful group of speakers today. I've had the pleasure of working with them since the beginning of the pandemic, and I've learned a great deal from them. And I'm excited for you to also work on your toolbox with us today. We are going to be doing a number of talks. We're going to start with Dr. Danielle Rubinoff, Defining and Fostering Resilience, working on creating your own personal surge plan with Alyssa Peterson, discussing self-care and racial trauma amid the coronavirus pandemic with Dr. Fortuna, and then talking about positive coping during times of uncertainty with Dr. Appel. And then we will have a time for Q&A. And so we're really excited to hear from you in the audience. Thankfully, Corey Jackson will be closing us today. I want to start by just talking about the vast number of emotional experiences that we have had since the beginning of this pandemic and sheltering in place in March. It's been a long several months. And I would say most people have felt like they have resonated with this slide, having these emotional experiences over the course of sometimes a day or a week. And most prominently, the kind of chronic, ongoing sense of uncertainty, not sure what's going to happen next or how we're going to deal with it, but knowing that part of the new normal, something new is going to be coming around the corner that we have to deal with. And so with that, just wanted to look briefly at what the evidence says are the folks that are most vulnerable for psychological sequelae or consequences during the pandemic. So we know that women and caregivers are bearing an extraordinary burden. This shows up again and again in research, that they're not only doing their jobs, caring for themselves, but also managing life at home for their partners, their children, and the other people that are dependent on them. Also younger populations, including adolescents and younger children, are seeing stress. Folks in lower socioeconomic statuses, as well as frontline providers, most especially nurses, anyone who's at high risk of contracting COVID-19, and folks who are especially affected by social isolation. We see that they are struggling with more and more anxiety and depression. And then, of course, the simultaneous racism pandemic that we know is going on affecting people of color. And it's been clear that COVID-19 most affects folks of color as well. And I'm really pleased that, you know, for the prominent, you know, things about Black Lives Matters in the news, and more excited that places like UCSF are really taking a look at that matter is the minimum and starting to highlight some of these things. And then we know that this also affects folks in the Asian community, as this has been often touted as a Chinese virus, and xenophobic statements have been stated. And so just a final kind of idea for us to look at before we delve into some of the content from the speakers is really the idea that our ability to kind of balance stress and coping has gone way off in the last several months. Our pre-COVID-19 life, which is sort of in a bucket now of things we hope to have in the future, had a lot of coping skills that we didn't even think about. We just were excited for these things. We planned these things. We did these things like travel, going to the gym, having weddings, graduations, birthday parties, looking forward to holidays together. And now all of those things are either missing or unclear how to do them, while our stress has continued to go up. And with that, we're still really trying to figure out, how do we cope? How do we manage this? You know, a lot of people have figured out things like trying to figure out some indoor activities, or we have Zoom socials, but it's really not quite meeting the demands that stressors have placed on us. And so with that in mind, it's really important to be intentional, thoughtful, and structured into how we incorporate new coping skills that we're learning day to day. And we're sharing with you today the things that we have learned thus far, and we will all continue to be learning these things together. And so with that, I want to introduce to you Dr. Danielle Rubinoff, who I've had the pleasure of working with closely. She's our lead psychologist for special interventions for COPE. She's also an assistant professor in our department, an affiliated faculty for pediatrics, a clinical psychologist, and she's a member of the Center for Health and Community. And she recently published an article, How a Pandemic Could Advance the Science of Early Adversity. And so I'm thrilled that she is here to talk to us about what is resilience.
Thank you so much, Margot, and thank you for having me. It really is a pleasure to be here and to talk about building resilience during times of crisis. So I think resilience is quite I get trouble advancing my slides. One moment. There we go. Resilience is such a buzzword these days. I think we hear about it a lot, particularly in the last few months. So I wanted to take a moment and think about, what are we really talking about when we use the word resilience? One definition that I like is this one from the American Psychological Association, that resilience is this process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. Now, that's a very academic definition. So I think what we're really talking about here is that resilience is the ability to bend in the face of trauma or stressors, but not break, to be flexible. Now, there are many pathways to resilience. Resilience can look so different in each of us. So I wanted to show a few pathways of how resilience might emerge. So in this graph along the bottom, along the x-axis, you're seeing time, with those red lines designating the occurrence of a stressor or a trauma. And then along the y-axis, you're seeing health, from poor health at the bottom all the way to better health at the top. So for some individuals, resilience might look like this. It might look like the ability to maintain where they were, to maintain their status quo, even after exposure to a stressor or trauma. For other individuals, resilience might look like this, where after the occurrence of a stressor, there is a very normative dip in how they're doing in their health and development, and then there's a return to baseline over time. Some individuals might show a pathway like this, where after the occurrence of a stressor, they actually have an increase in their health or their functioning. That's that idea of post-traumatic growth, that we can actually learn things, develop coping strategies that help better ourselves after a trauma or a stressor. And resilience can also look a little bit messier. It can also look something like this, with lots of ups and downs over time in a very non-linear trajectory, but that's still resilience too. Now, we talked a little bit about what resilience is, but I want to highlight the things that resilience isn't too. So resilience is not a personality trait. You're not just born with it, get lucky enough to get born with it. It's actually something that you can develop over time. It's not an on-off switch. It might be nice if we could just, press our resilience button, but it really does not work like that. It's a process, something we practice and develop over time. It's not grit. So resilience isn't something that if you just were to work hard enough or try hard enough, you would develop it. That's more grit, and that's not resilience. And it's not all or nothing. So it's not the case that you have to be totally resilient in all aspects of your life, but rather there might be some aspects of your life where you show resilience and others that you don't. So as we talk a little bit about resilience building strategies, I wanted to highlight something really interesting that we've learned from our research. There was a study that asked lots of people about their experiences of stress and adversity over the course of their life, and then also asked them about how satisfied they were with their lives, their life satisfaction. And they looked at the association between those things, and it looks something like this. So what's really interesting about this is that they found the lowest levels of life satisfaction among those individuals who reported either very, very low or infrequent occurrences of stress or adversity in their life, and also those who reported very, very high stress or adversity in their lives. But what's interesting about this is that the highest levels of life satisfaction were reported by those individuals who had encountered some exposure to stress or adversity in their life. And what's important to note about this is that it's really suggesting that exposure to moderate stressors and challenges is an important part of helping us develop resilience. So, some of what we're going through right now is actually an important part of resilience building. Now, to talk a little bit more specifically about some of the resilience building strategies that we know are effective from our research, some of the most important ones, the most effective ones are around building high quality social relationships or social connections. Of course, that's even more difficult right now when we're in this time where physical and social distancing is something that we're needing to do. And so things like creative Zoom gatherings that lots of people are doing, you might have attended Zoom baby showers or bridal showers or birthday parties. Those sorts of things can help us try to maintain those social connections. That being said, I think there's a lot of Zoom fatigue going on right now among all of us. And so it's important to remember, even though we have access to Zoom, it doesn't mean everything has to be done over Zoom. And sometimes something as old-fashioned or basic as a phone call can be really effective. And I like to schedule phone calls where I can take walks and talk to family or friends, and then I'm getting a little bit of exercise and connecting with people too. And then as we are able, as the health guidelines allow, having some outdoor socially distant meetups is another way to try to build and maintain those social connections. Realistic optimism is another resilience building strategy. And what I mean by that is something reasonable. So not Pollyanna, not saying that everything is great and wonderful and rainbows and butterflies. But I think times like these, it's very common to kind of get into patterns of extreme thinking, thinking that everything is bad or things will always be this bad, and kind of taking a step back to gently question whether that extreme thinking is completely accurate can be really helpful. And one of the things that can be helpful in doing that is engaging in a brief gratitude practice. It can be something as simple as at the beginning or end of your day, noting just 2 or 3 things that you're grateful for to remind yourself that there is a balance here. Meaning making is another strategy that can help us build resilience. I showed you that graph earlier where individuals were actually having that experience of post-traumatic growth or engaging in things that helps them gain better health and coping even after a stressor. And that can come from making meaning out of our experiences. So thinking about what changes you've made that you might like to maintain after the pandemic, new habits that you've acquired, and thinking about whether there's a silver lining to this pandemic. And that silver lining does not mean that you haven't been through stressors and challenges, but it coexists. It can occur even amid these stressors and challenges. And last couple of resilience building strategies to think through. What is this idea of turning outward? So right now, again, particularly with social distancing, there is a tendency to kind of turn inward, and that's magnified. Experiences of stress and anxiety and depression can also lead us to turn inward and to withdraw. So the things that we're doing to turn outward, like contributing to a larger cause and helping others, can help us build resilience. And finally, the idea of acceptance. And what I mean by acceptance is not resignation or giving up, but really thinking about accepting what you cannot change in this moment, because there's a lot of things that we can't change in this moment, but reorienting to the things that we can change. Oftentimes those are the things that are what's in our control, can be really helpful. And one of the things that does help us do that are our mindfulness practices, because they are really focused on reorienting us to the present moment and what's going on right now. And that is all I have. Thank you so much.
Hi, thank you so much. I love hearing about what resilience is. I feel like it can always get a little fuzzy in my mind. I love the idea that stressors can actually lead us to developing more resilience and more life satisfaction. That's such an encouraging idea. And so with that, we can turn our thoughts towards that next big stressor that could be coming our way. And so Dr. Alyssa Peterson is going to be talking about creating your own personal surge plan. She is an associate clinical professor in the Department of Psychiatry and Behavioral Sciences and is located at Zuckerberg San Francisco General, where she is clinical faculty, a site director for the residency program, and also in charge of intensive services and inpatient work. And with that, take it away, Alyssa.
Great, thank you, Margot. So today I'm going to talk with you about developing your personal surge plan. And the word surge, that's been thrown around a lot over the past 7 months. This term is usually used to apply to the number of COVID cases that are in our hospital or in our community, but it also can be applied to our own stress levels. We're all experiencing a surge in stress these days, as we all know, from COVID, from the goings on in this world, or even just from interpersonal things that are happening in our lives. So as I walk through this, also having a little bit of slide fancy problems. There we go. Okay. As I walk through this, I know some of you don't have access to a screen, so I'll try to talk it through. It's going to be hard to run through it with this slide set, but if you go to our UCSF website, which will give you some links to at the end, you can walk along with a video that I've created and create your own plan. This is a 4-step process. What you're going to do is take a piece of paper and divide it into 4 quadrants. And at the top of each quadrant, you're going to put the following headers: my personal stress response, my stress danger zone, my current coping skills, and new coping skills. And I'll go through these in turn. So when we think about stress, there's a lot of effects on our body when we are under stress. Many of you have probably heard of our sympathetic and our parasympathetic nervous systems. And our sympathetic nervous system is really what gets activated when we're under danger, when we perceive danger. So I think about in caveman times, this is what helped us run away from bears and scary animals, things of that sort. It's our flight or fight response. So when our sympathetic nervous system is activated, our heart accelerates, our bronchi and our lungs get dilated, our pupils dilate, so we can run fast. And our parasympathetic is the counter response to that. That's really our rest and digest response, where our heartbeat slows down, our stomach stimulates digestion, we're calm, we can rest. During stressful times, we are living in this sympathetic zone, and there can be some chronic concerns with that over time. But we also can learn to recognize what's happening to our body based on sort of our sympathetic response. So what does your stress response look like? Everybody's is different, but there are often common themes, mostly related to sympathetic drive, but there's effects physically, cognitively, behaviorally, emotionally. It depends on who you're with and where you are, but here are some examples on this slide of things that can happen for folks. You might sleep too much or sleep too little. You might get really fatigued or tired, memory troubles. Some people avoid things that they used to make them happy or things that they feel are stressful. That could be social interactions, for example. You might have racing thoughts, feel jumpy, edgy, decrease or increase in eating certain foods or just food overall. And then certainly irritability is a common one. But again, these symptoms are really self-defined and only you know what's normal for you. So that's what's going to go in your first box, my stress response. And you'll see I'm sort of filling out an example in the slide in the graphic. The second box is for your stress danger zone. And this is what happens to your body when you're really in overdrive. You're at the end of your rope, literally and figuratively, and you just feel like everything is falling apart. I'm sure we've all been there in these past couple months at various times, and sometimes we've been living there more than we'd like to admit. So, for example, you might lose emotional control and just feel, completely furious at small things, start crying all of a sudden. Some people get really short of breath and panicky and have panic attacks. You might not be able to focus on things that you previously could focus on, like work. You might not be sleeping well for many nights in a row or waking up a lot in the middle of the night, yelling at kids, your partner, your friends. And then certainly we've seen a lot of increases in alcohol or cigarettes, other mind-altering substances that people are using to numb themselves because they're just feeling like things are over the top. That's box number 2. And now that we've sort of defined what happens to our body when we're just, sort of moderately stressed and seriously stressed, we get to think about how we're going to cope with this. And you all have current coping skills, which is box number 3 that I'm going to be talking through, that you use. So take some time to reflect when you're walking through this on your own. We're all very resilient people. We've made it through tough times in the past. And, we may not be relying on these coping skills as often as we would like, but we've got them in our repertoire. And sometimes we just have to pull them out. Again, some examples: call a friend, family, a support person. Just breathing, taking 5 deep breaths or 2 deep breaths can be really helpful. Some people like to listen to music or dance or take a walk. I know Danielle was just mentioning that. Meditating is a common coping skill for folks. I personally like to just go sit in the sun because it's easy and so far available in the Bay Area. That will be a little more difficult in a couple months, but that helps me quite a bit. And then for others, it's praying or some sort of spiritual practice. And again, there's a myriad of other examples that you could come up with that work for you. The final step in this plan is new coping skills. So we always want to be learning and growing. And this is, if we think of a silver lining, this is an opportunity to do that. This is the perfect time to add new coping skills to your repertoire. And if you're at this webinar, you're probably thinking about doing that already or have been doing that. So what have you always wanted to try out? And if you don't have any ideas, you can look to things like maybe this workshop. Hopefully there'll be, I know Danielle gave us some ideas and there'll be some more ideas later on. We have a UCSF Psychiatry COVID website that Margot's going to talk about, and there's tons So I often see people decide they're going to meditate for 20 minutes every day, for the next month, and they're just sort of bound to fail if they've never meditated before and then feel badly about it. So if you want to do meditation as your coping skill, think about meditating for 1 minute every other day. Try to incorporate it in, and then rise and do more every day as you can do it. The worst that can happen is that it doesn't work for you, and you move on to something different. And finally, don't let skepticism get in the way. I put this in there, almost for myself, because I think if anything, sometimes when someone tells me to do deep breathing, and I think we're in the middle of a global pandemic and the world is falling apart, it just feels like deep breathing won't cut it. But I'm here to tell you that it actually will if it's incorporated in a regular way into your daily routine. It's not going to cure COVID, it's not going to cure our problems, but it's certainly something like deep breathing at a very minimum can give you some space to take care of yourself, and it can calm that sympathetic drive and really help. So at the end, you might have something that looks like this. Yours may be much more beautiful than mine, so feel free to color it, create it, and add and adapt to it over time. You can post it on your refrigerator or somewhere more private, so you'll just be reminded of what happens when you become stressed, but also the skills that you have to combat that stress and new skills you're challenging yourself to try out. Thanks. I'll pass it back to Margot.
Thank you so much, Alyssa, for sharing that. I know that really came out of a lot of work with staff and chaplains at San Francisco General. So thank you for sharing that. So applicable to so many people. Next, we're going to turn our attention to Dr. Lisa Fortuna, who we had the privilege of coming to UCSF, I think, almost a year ago. I think we're coming up on your work anniversary. She is the chief of psychiatry at Zuckerberg San Francisco General, and she is also a vice chair of psychiatry for our department. And she is an associate professor of clinical psychiatry and an NIH-funded investigator for studies on Latino and immigrant mental health, integrated care, and access to care. And she is a primary investigator for Patient-Centered Outcome Research Institute as well. And so we're really excited to have her here today. She is going to be sharing on self-care and racial trauma amid the coronavirus pandemic.
Okay, thank you, Margot. So good afternoon, a pleasure to be here with you all. We can go to the next slide, the first slide. So a lot of the things that we've been talking about so far are helpful with racial trauma, but what is it first? It's a form of race-based stress. So it refers to when people of color or indigenous individuals have reactions to dangerous events and experiences that are related to racial discrimination. Those can include experiences of threats of harm and injury, shaming, humiliation, dehumanizing events. I would put xenophobia in here as well, and witnessing racial discrimination towards other people of color and indigenous individuals. And we've all experienced some of this in 2020 and even before. And it really involves individual and collective injuries due to exposure and re-exposure to these stressors. Next. Yep, next slide. And the signs of racial trauma can be really similar to other trauma or stress responses, which can be anticipated and in many ways are normal. And what we're really trying to do is make sure that we manage those so that those do not become overwhelming. So you can have re-experiencing of the distressing events like recurrent memories, pain when you're feeling distressed, like headaches and stomach aches, fatigue, sleep problems, depression, feeling unmotivated, really feeling like you have to watch your back, avoiding situations that remind you, physical illness. All of these things can be a result of being exposed to those things. Next. So what can we do? The first thing I think is what we've been talking about so far is being able to be aware and recognize the symptoms. You know, am I experiencing at this time some of the things that I listed in the previous slide? So awareness is the first step. And then we can talk about our feelings with others and really limit our own and our children, if we have children and family, exposure to news media and viral videos that continuously show us these very sort of traumatizing, potentially and negative things. Next. And then we've been talking about this, the importance of connection, being seen and heard is essential to healing. And so we need to connect with friends and engage with others who can be in racially conscious conversations, right? And willing to help you process your thoughts and emotions. We're not meant to be left alone with these thoughts. And, you know, sometimes it's just really helpful to have those friends, allies who are willing to engage with us in thinking this out. Next. We've talked about this quite a bit: spirituality, engaging in prayer, mindfulness, spiritual practices, and use of mantras. And I just want to say something about mantras, sort of these sort of positive messages that we can tell each other, tell ourselves and one another. One of the ones that, you know, I was just thinking about and going into this was this idea of, you know, I'm standing on the shoulders of giants, right? And what helps me there is to think about all of the people who've come before me, and we all have those people who've come before me who have survived. And that's why we're still here. And so in that mantra of sort of, you know, standing on the, you know, shoulders of giants, or, you know, thinking about my grandmother who overcame so much for me to be here, that gives me a practice that also encourages me. Next. And then we have to uplift ourselves, you know, and, you know, that's part of self-care, doing things that make you happy and inspire you, right? And this can be music, gospel or otherwise, you know, whatever makes you sort of work in a different rhythm that uplifts you, reminds you of what joy can be, because we can find that joy even in the most hardest times. And just those small moments can make a tremendous impact. Next. And then we need to prepare and repair. Role play how to respond to negative racial encounters. I mean, if you have experiences that you know are going to trigger that, or are those types of experiences, it's really important to work with trusted people in your network to say, you know, how would I approach this next time? What can I say? Can you have my back when this is happening? And you can make a list of these situations, people or places that trigger your distress. And yeah, we can go to the next one. And strategize how to cope in these situations, right? Do you need to do some self-care before you encounter this? Do you need to touch base with somebody right after? Who's going to be there? And then have self-care and self-compassion with yourself if it doesn't go exactly the way you wanted, or if you do feel harmed. Make sure that you're first and foremost saying, I need to take care of myself. Who am I going to reach out to? Next. Yep, next slide. And then we can have agency and activism, right? Racism is a huge problem. Xenophobia with that can't be solved by a single person. So we really have to engage in this as we feel comfortable ourselves individually. But feeling empowered involves participating in actions too to solve difficulties. And we need definitely partnership with allies, please, in being able to work together towards taking action against these underlying things that harm us. Next. And do a self-check-in and ask yourself if you need help or someone to talk to. Seek professional help, therapy, counseling if you need it. That, you know, there's no shame in that. And in fact, you know, this is something that we're encouraging people very much to do. So I think I might be towards the end.
There you go. Thank you so much. Am I still muted? There you go. Can you hear me now?
Yes, we hear you.
Thank you. Sorry, my Zoom was doing strange things. It was really great to hear you. I've heard so many talks. We've had so many things come up about, racial trauma. It's really helpful for me to hear all these tips, personally on coping. So thank you for sharing that. I feel like we need to talk about, how we manage these things. Next, we have Dr. Alyssa Appel, who is a stress researcher. And so I think has a lot to tell us about. She is the professor and vice chair for adult psychology for our department. She's the director of Aging, Metabolism, and Emotion Center and the associate director for the Center of Health and Community. She studies psychological, social, and behavioral pathways under chronic and psychological stress, and stress resilience, especially as it impacts cellular aging. I can go on and on about the things that she does. One thing I do want you to know is that she is the brilliant mind behind our amazing resources at the Psychiatry website, which has continued to be built over the pandemic and will continue to be built out, trying to have as many things that are helpful, not only for our employees, but also for the Bay Area community and the community at large. And so with that, she's going to be talking to us about positive coping during times of uncertainty.
Thank you so much, Margot. Very sweet introduction. What a pleasure to speak after my colleagues, Dr. Rubinov, Peterson, and Fortuna, because I mean, you just all heard phenomenal advice, and we need a toolbox. We really do need it all. And we need to pick, look at our resources and pick the pieces we need, because these are really complex times. So you've made my job easy by going last. I want to put together what we just heard. So one question is, what tool do you need that's in the toolbox? There are lots of different kinds of stress. Margot showed us this big list of the stresses we're under, the twin pandemics, the racism, the pandemic, and now we have this political stress blanket on us too, right? We have election stress, and we don't know how long that's going to go on for. So once you do this kind of self-assessment of how am I going to last the next few weeks and the next 6 months? These are really different questions. So I'm going to touch on both dealing with the acute stress and dealing with this ongoing kind of pandemic and pandemic fatigue we might feel. Well, the good news is that we heard from Dr. Rubinov about pandemic resilience. We may not notice it, but we are all building pandemic resilience, and we are coping amazingly well. We're here. Those of you who are logged on, you're doing the best you can, and you're trying to pick up new skills, and that's fantastic. And we're all in the same boat here. So Danielle pointed out so many great resilient skills: the social connection, the realistic optimism, turning outwards, connecting with other people, thinking about how we can also be helping the different situations we find ourselves in. And part of that realistic optimism is finding the joy where it exists. And so the glass is certainly half full. I mean, we are having so much going on in our lives and in the Bay Area, and the glass is half empty. So looking at what we do have and feeling that gratitude. And what Lisa said about the uplifts, I love that word, because most of our coping is these daily things, but it's the things that elevate us and move us and make us feel connected that really count. And they may be short, and they may not last long, but boy, are they balancing. We need those. We have a lot of bad news, heavy bad news, very little good news. So we need to share some good news with each other and just notice the little bit of joys in our day. And that is part of positive coping. And so I'd like you, if you know someone who's logged on, or you have a close work friend, I'd like you to have a pandemic buddy or a resilience pod with them, and text one complaint and one positive thing, regardless of how little it is. And so you're going to get 2 texts from this kind of resilience buddy. And you could do that once a week. You could do that every day next week, since it's going to be the election week. And those ways of kind of connecting and also noticing joy are really helpful. So we heard from Dr. Peterson about danger zones. Look, we've all been in danger zones. This has been, I don't need to say anything but 2020. And that seek help. If you are experiencing those severe states of stress and you know it's interfering with your life and your sleep, boy, we really want you to ask for help. There's the COPE program that Margot will talk about, and there are different resources, helplines, hotlines, warm lines on our website. The racial trauma is, I found my heart beating and racing. And I just want to also thank Dr. Fortuna for naming and explaining the trauma that so many of us, so many of our UCSF members are experiencing, that we need to hear about, understand, and better support. So these racially conscious conversations are things that we, regardless of our skin color, white allies, we all need to have these. And boy, they're uncomfortable. We're not skilled. We don't have the fluency to talk about race and what it means. And we need to be on that edge. And if we're uncomfortable, then we should practice the conversation with someone we feel safe with, so that we can be talking about what's there and these elephants in the room. Because next week, we should be prepared to see, let's just say we don't know what we're going to see on TV. There may be protests, there may be violence, and we should be prepared. So we should look at our day and our schedule for November 4th and see what we can do for self-care that day and lighten up our day. And I want to end with a point that Dr. Peterson made about breath. That's going to help. I mean, we're dealing with existential crises and a pandemic. And I just want to say, yes, it can help. Guess what? We are like scared animals. We're not we are. Like, that is our body. We respond to stress with our survival response. And the beauty is that we can also dial it down consciously with deep breathing. And we've got, some samples on our website. We also, there's those apps that you could be pinged with, kind of to make it more of a habit. So the control what we can control does come down to also in the moment, as Dr. Rubinov said. So when we can slow our breathing and actually become more regular in our breathing, those two things do turn on our parasympathetic nervous system. And we need those breaks, and we need them every day. So let's just, everyone now put your hand on your heart and do a check-in. I would like you just to notice your heart, your quality of your breathing. And as you notice your breath, you are slowing it, or you can slow it even more. And that's the power that we all have and that we can use more. Thank you, Margot.
Thank you, Alyssa, so much for sharing, and also for doing such a great job of kind of summarizing and hitting on a number of points shared by our speakers. We are going to turn this time to have some Q&A, and we'd really like to hear from some of you in the audience. I've already got a couple of questions, so I'm going to start with those. The first one is from Jenny Allen. What I took away first is recognizing and being aware what my stressors are. What are some ways to self-assess and help determine what my stressors might be? And really like the resilience chart, wondering how to determine my baseline. Danielle or Alyssa, any ideas about how to figure out how you're doing right now, where you're at?
Yeah, that's a fabulous question. I think that's so important right now, because with the combination of emotions that we're experiencing, it can feel really jumbled, and I think hard to get a beat on what's going on. It can just feel like I feel stressed, but I don't know what that feeling is. And so one of the things that I think can be really helpful, as Alyssa mentioned, is that awareness piece. So when you, oftentimes we have a physiological reaction. You might experience your heart racing, your breath shortening, your palms are getting sweaty, and that physiological reaction can be a sign that something's going on right now that I need to pay attention to, and can be your sort of physical reminder to take a step back and think about what's going on for me right now. What did I just experience? What's happening in my environment? And really, I can try to be specific about what is the emotion that I'm experiencing. Am I anxious? Am I overwhelmed? Am I stressed? So I think in some, using your physiological cues to help you tune into what might be going on for you emotionally.
Great, thank you so much. Let's see. Another question that's come in is any tips or advice on how to handle tricky situations with loved ones who don't take the same viewpoints seriously when it comes to gathering during this pandemic? Some may make some passive aggressive statements towards you. I think what the audience member is asking about is, I feel like this new social kind of norming of how do we talk about our risks and how we feel and what's appropriate. And some people seem very sensitive and some people don't. And how do you kind of manage that? Anyone on the panel want to take this one?
Well, I'll just say I'm glad it wasn't about how you manage political differences with your family and friends, because those are less manageable. I think that during this time, no one's going to change their vote. We're not going to convince people otherwise. And our job is to, just try to have patience, tolerance, compassion for other viewpoints that we just may not be able to understand, we can't have. But what you explained, Margot, about feeling at risk. And, I don't think we need to prove data and say, well, I have an immune disorder, but just that you're concerned and that you're, I was on an airplane with goggles and I looked like a bug. I was so covered up. And I just kept saying to myself, what other people think of me is none of my business, because it's just so important to do what we're comfortable with for safety. So I think the best we can do is try to, talk about comfort level, and rather than try to prove things with, diagnoses. And it's also important to be around people you're comfortable with, especially in the next few weeks. And I loved your idea, Margot, to if we're going to do something that's really triggering or stressful, like watch certain things on TV, to do it with people who are like-minded or we feel safe with, or a friend, distantly saying, let's watch this together. And I did want to just point out, we have a write-up from our department on coping with election stress, which is different than the social distancing piece. Does anyone have advice on the social distancing piece, that tough conversation with people who have different views?
Go ahead, Lisa.
Alyssa and I had put a little bit of statements in the chat too about, I like Alyssa's sort of, comeback, have a comeback ready, right? Like, even if it's funny, right? And just keep on going. It's almost like we tell people when they're trying not to drink and everyone's telling them to drink, right? Sort of have a funny, just a funny little thing that you can say as a comeback and keep going. And I said, you could also put it straight on that, you're doing it out of care and love, protection for them, right? And if that is not good for them, you can just say, that's what it is, and let it roll off. But you have to be true to yourself and what you feel is right.
Yeah. I think the other thing to add is, I think all our stress levels are high. Mine is, yours is. And so when we have our interactions, it's important to bring compassion to ourselves and compassion to others. You know, I don't know what's driving someone's interpretation of COVID-19 related public health recommendations. And speaking of the, someone is asking a question about suggestions for upcoming holidays, especially if family and friends are far away. This is such a great question. Actually, we brought this up in our COPE meeting this morning, and are planning to put up something kind of larger and more thoughtful on the website in the coming weeks. So you can look out for that. One thing is, I would highly suspect that San Francisco Department of Public Health will come up with recommendations. They've been pretty faithful at coming up with recommendations kind of for various stages. And I, you know, would really encourage people to adhere to those recommendations for all sorts of reasons, but mostly safety. You know, I completely sympathize because my family all lives far, far away. Oh, I just took this question, by the way, panelists. So it's something I think about all the time for various reasons. You know, we will not be traveling. And so, yeah, we've already been thinking, you know, how do we share, you know, holiday traditions that are important to us with people far away. And you know, more suggestions to come, but I think some creativity and trying to be safe will be really important, as well as grieving the loss of things that we don't get to experience this holiday season, which is very real. Okay, another question. Can all this stress manifest in body aches like headaches, back pain, or just plain fatigue?
Oh, I can take that one, absolutely. I'm sorry, is my sound okay on this one? I know we had some difficulties earlier. Yeah, it's people can feel really sick under stress. You can feel like you have the flu or a bad cold, or you know, just completely run down. So that's definitely something to keep in mind and to pay attention to in your body, and then react accordingly. Maybe you need some sort of break if you can get it.
And it's important to take a break, you know, because sometimes we might feel like, let's just work through it because I can't stop. And when you're really having those pains and aches, that's when your body's really saying you need to take care. You really need to take care.
We have so many questions. I can already tell you that these questions are going to spur us on to do more work on our website and create more videos for you. I love that you're sending this. It's really helpful. Some of you are kindly answering for each other. I'm going to go to any tips for helping kids, specifically teens. My daughter has entered a phase where she doesn't really want to be around her parents, but I am worried about her mental health. Absolutely. This is such a pressing and exceedingly common question during this time. I don't know if Danielle, you'd like to take this?
Sure. I think this could be its own hour-long panel. It's just such a significant concern. I think a couple of things I'll very briefly say, because I know that we're running out of time, is that there is support available through telehealth options, and I want to normalize seeking support for children and adolescents through whether it be informal or formal therapy. That might be something depending on the level of concern. Some of the same things that we've talked about in terms of trying to build social support and social connection, which is so important for adolescents. Also, the strategies that we talked about for ourselves, I think also apply there. But the last thing I'll say is that there's a whole section on the Psychiatry website for children and families that has some more more specific tips that we don't quite have time to get into today. So I would certainly start there, because that might also be helpful.
So I know we're at time. I'm going to ask permission to just go a couple minutes over, because there is a question in there, and although I'm like struggling to find it now, that Lisa wanted to answer about ongoing racial trauma and stress.
Yeah, I'm just going to say, quickly, and I think we should continue this discussion because it's a very big one. More than ever, we need to stick together on this. I think one of the most damning thing about racial trauma is when it's not acknowledged, and when we don't have a network and support system to work towards improving what's going on. And so, it's a critical issue right now. I think a lot of us are facing a lot of emotional issues around this from different perspectives, as well as, to be honest, with the elections that's in there, right? In terms of sort of how we might think about these things differently. And someone put a comment on that about feeling harmed, right? By people not seeing it. And so for that reason, I think it's really important. We should put more information about how to access networks if you do not have, because someone said, how do I get the network? We'll put some more information on that website about where there are networks to be able to talk safely within groups and across groups of how to manage these feelings and to talk it out, and then if you feel like there's power over you, where someone who has power over you, can't work through this, that's another place where having colleagues together and strategizing about how to keep everyone safe, right? Emotionally in the different work experiences that we have. You need to have colleagues, you need to have partners, accomplices in resistance, I call it. And that's the only way it's going to help you. It's very hard to go as an individual and just sort of take it on by yourself, I think, as well as that self-care.
Thank you so much, Lisa. So a couple of things with our last couple of minutes. One, here's our website. I always tell my friends, patients, colleagues, just Google UCSF Psychiatry, and you can't miss the giant red coronavirus COVID-19 button, and that will lead you to all of our resources. And then I also really want to highlight that UCSF has tremendous amounts of resources for diversity, and they have a wonderful website as well that I encourage you to take a look at. And then also, so you've given us lots of questions. We will be mulling these over and thinking about how to respond to these on our website. Also, in 2021, we're going to be having a series of topical UCSF-wide town halls on many of these topics that you guys have brought up, including additional issues on racial trauma and responding to that, dealing with COVID-19 and people that you've known that have had it, caregiving and related stress, pandemic exhaustion, as well as ongoing issues of mental illness. And with that, thank you so much on behalf of myself and the speakers. We are just incredibly grateful to be with you. We are so appreciative of what everyone does at UCSF and are so glad to be a part of this. So thank you so very much.
Thank you so much, Margot. I'm just going to take a brief moment to introduce our closing, for our closing remarks. It's my pleasure to introduce Corey Jackson to close our webinar today. He is the Senior Vice President of Human Resource for UCSF Health, the Associate Vice Chancellor for Human Resource for UCSF Campus. He is a talent manager leader, and he has a real focus in his career on diversity, equity, and inclusion. And he is the Chief Human Resource Officer for both campus and health. Corey Jackson.
Thank you, I appreciate it. Just before I get into sort of the closing remarks, I was asked to talk about, what happens when people are afraid to talk to a supervisor. And, Lisa kind of mentioned this in terms of getting allies, but you can always come to HR, LER, the Labor Employee Relations people, to talk about these things confidentially as well, and just confiding in colleagues that can help, the conversation. with that particular leader. There's a lot of different avenues there, and we would definitely love to help in that situation. But sort of my comments, I'll try to be brief, but thanks for inviting me today and for hearing so many dynamic speakers. I also want to thank this UCSF Staff Assembly, Administrative Management Professionals, Diversity and Inclusion Certificate Program alumni, 4CI Subcommittee for hosting this event. Margot mentioned at the beginning of today's conversation for us to be intentional, thoughtful, and structured. I would also add that we should probably exercise some grace with one another and including ourselves. It's okay not to be okay. We're trying to navigate what none of us probably planned for while making impossible decisions with very little or sometimes too much information. The important thing to remember is that this has been confirmed to me during this webinar is that we're not alone on the journey. As some of the speakers said today, you're not born with a certain amount or a fixed amount of resilience. It's like a muscle, you can build it up, draw on it when you need it. In that process, you'll figure out who you really are, who you just might become in the very best version of yourself in the process. This webinar is focused on tools and resources for building your emotional toolbox during this pandemic, during racial trauma, all the other things that are going on right now. And so it kind of reminded me of a story of two wolves. Some of you may have heard this story. It's an old Cherokee Nation story. And it says an old Cherokee was teaching his grandchildren about life. And he said, a battle is raging inside me. There's a terrible fight between two wolves. One wolf represents fear, anger, envy, sorrow, regret, greed, arrogance, self-pity, guilt, resentment, inferiority, lies, false pride, superiority, and ego. The other stands for joy, peace, love, hope, sharing, serenity, humility, kindness, benevolence, friendship, empathy, generosity, truth, compassion, and faith. The old man looked at the children with a firm stare. So the same fight is going on inside you and inside every person too. They thought about it for a minute. Then one child asked his grandfather, which wolf will win? The older Cherokee replied, the one you feed. So again, thank you everyone who put this great webinar on. I also applaud all of you for attending this webinar, taking advantage of the resources available here at UCSF, and most importantly, taking a sort of proactive approach to exercise some grace with yourself and be an ally for members of your professional and personal community. So with that, I'll turn it back over.
Thank you so much, Corey Jackson. We cannot thank you enough. Just a reminder to everyone that this has been recorded. The slides will also be available. We'll send out a link, and we're sending out a Qualtrics survey with the thank you materials, and that will have some ideas. We want feedback, questions. This is one of the first large events like this we've ever done, and we are so open to feedback and thoughts about how we can continue. Such a diverse group of staff groups can really continue to serve everyone here on campus for all of our staff. Thank you, and thank you so much again. Thank you, everyone, and everyone have a wonderful rest of your day.